first of all, in terms of it not being an official training, I specifically didn't bring anything to distribute. I want it to be more of a question and answer, and where are you guys, and what have you heard, what are you confused about? But great news. Probably around the end of May, beginning of June, there is an official training being developed for providers, and we have three: Sylvia Murray, Mike Piera with PALS, and Bev Young with Midwest Health Services are all being trained as trainers. And we got to go see the kind of the rollout of the training last Tuesday, and it was excellent. I'm really excited. It's going to be about a 4-hour training, but it really says, okay, like, here's this piece of Imagine. This is like the discovery part. This is the role the provider plays in this. It kind of breaks it out by each section of the planning process and makes it very concrete about, what the provider's role. So I'm really excited, and that will be coming out soon. That's why I specifically didn't want to bring things to distribute, because I don't want to confuse anything in terms of with the official training that's going to be coming out soon.
And when was that training going to be?
They are hoping to have Mike, Sylvia, and Bev trained as trainers by the end of May, so they will be able to start holding the trainings. And the idea will be to do it, I don't remember the exact number that they were saying, but to keep the numbers pretty small for the most effective trainings with smaller groups. I want to say they were thinking like 20 to 25-ish at a time. So just informal questions.
Is documentation. We have a service coordinator tells us to make a checklist off the old ISP standard. Because in the Imagines, there's nothing about guardrails,
Doctor's appointments.
doctor's appointments, anything like that we used to do.
Right.
The question is about documentation, and that the ISP used to ask about doctor's appointments and things like that, and now it's unclear as to how to complete the documentation.
Right. So when you're talking documentation there, you're not talking about the documentation for the Imagine plan, you're talking about your Medicaid HBC docs.
I got 2 people right now starting this new Imagine plan.
Mm-hmm.
One of them's got 2 outcomes, 1 code on the first outcome, 3 codes on the second. Those I ain't had problems with.
Okay.
But now they're asking us, well, what about guardrails, grocery store, laundry? How you document that?
Okay, and that will be included in the new, in the training that's coming out. But just in general, just realize what was suggested at this point, just because providers were uncomfortable with not doing any of that check boxing. So we just said, for now, if you're uncomfortable doing that, just take your old doc sheets, get rid of all the old fluff that we don't need, make it very specific to the person, and if it makes you feel better using that, go ahead and use that. But the other thing I want to encourage you to do is because this whole focus is supposed to be having more time with people and less time on the paper, and the paper that's there should be very meaningful. So if you have documented something in one place, you don't need to document again. For example, if you take somebody to the doctors, and you have the physician's consult form, you have that all filled in, and I can likely keep it in a binder and send a copy to the service coordinator, you have documentation at that point. So there's no reason to go check a box that you did it. So like the first step is kind of getting rid of some of the duplication.
But like with hygiene, like I work at an agency job also. So if you have somebody that's, not documenting whether they did showers or, how do you know it's being done when you come in for your shift? Other than they say you're gonna smell them, but how do you know that's getting done?
And that, in terms of agencies, is being very much left up to those agencies, what they want to have their staff document. So if for staff, staff training or staff accountability, that agency chooses to have some of those things, that's up to each individual agency to decide.
We're not going to come in and look at it like we have in the past, or to monitor. So it's really just for your own use, for the agency's use, not for us.
Yeah, the last training they had, one of our other people that works with us said that they had mentioned in there, like the hygiene and the fire drills and the doctor's appointments wasn't in that ISP, you wasn't supposed to be doing it. So that was what was told in the last training. So how do,
Yeah.
it's confusing to everybody.
Sure.
First initial meeting, they had a check. If it wasn't listed in the imagine, don't do it.
Yeah, that's not
When you
it.
imagine, I've only got two things to do in a 5-hour period.
Okay. Now think about that plan though. When they say that Imagine plan, and I apologize that such messages have come out. All of those things that we need to do to care for a person, we still do. That hasn't changed. Those outcomes are around helping them to achieve something they want out of life, and there's a separate documentation for that. But a big mistake we made early on, and we totally own that, is we were not sending out the discovery results pages with plans. And in reality, they're a part of that plan. They will all be coming to you now. And I would say if you ever see a plan without all the discovery results, and that's where you find a lot more of the detail, don't sign it. Say, I need to see those discovery results. Because within those discovery results, they're like the communication and learning, the day-to-day life, health and wellness. That's where it captures all that other information. Like in health and wellness, doctor's appointments, yes, they have supports in place and they continue to need those supports.
Are you guys seeing the discovery results? No? There's like 9 sheets. I saw that you were writing them. So you haven't seen those?
I am still waiting to see paperwork. That's because it's hard for me to figure out what's going on without some kind of paperwork.
What paperwork do you mean? Like any?
For documentation. I mean,
Okay.
So that's what a lot of us providers have a problem with, is documentation of some of the stuff. We're being told to do it this way, and we have a person from the state does it, they can't do that. They do it this way.
But in regards to, is it Nancy? You used to get something printed out, right?
yeah, the social.
Or the documentation.
The ISP
I would
plan?
always get it from like Casey.
Okay, from
Or-
the service coordinator?
Yeah.
Okay.
And so everything's different now. So I'm still working on the documentation that I had with her, but now I've got a new Daryl Waterman is.
Have you received, when you get the documentation that's actually for the plan, meaning the documentation for the outcomes, that's the learning logs. Have you had the opportunity to complete a learning log yet, or to work with the service coordinator to write the action plan for the outcome?
I had a meeting. I just had a meeting this week with them, and they was trying to walk us through it, but again, I didn't get paperwork. So,
Did you have a meeting with the service coordinator?
yes,
Okay, and you were working through like,
I did get the a blank sheet with the one with I can't think of the name of the sheet. It had the different boxes and, okay.
The only two forms that you're going to use to document for Imagine would be you create an action. Once the ISP is written, you create the action plan.
Yeah.
You can do that. The service coordinator for the person can help you do that. And then once the action plan is in place, the provider is responsible for completing learning logs. And then you have to turn those into the service coordinator at whatever frequency is specified under that outcome. Those are the only
Okay,
documentation
so there's
sheets
only
you'll
two
need.
sheets.
In the action plan, I wouldn't even call it a documentation sheet. It's more like you set that up at the beginning, and then you can modify it if needed. But the sheet that you're going to actually document progress on is the learning log.
The learning, okay.
Have you guys all seen the action plan? No, I'm gonna get it up.
Thank you.
I'll pass it around.
And the action plan, I think, like, it has, I don't know, I'm a little uneasy, but in reality, okay, let's use an example. Maybe somebody wants to get their driver's license, and you, the provider, are going to have a role in helping support them. So if you just think about, well, what are you going to do to help them? Like, I think providers have always done action plans. What are the things you need to do to help support this person helping them achieve something that they want? It's just you think about it and you do it. Well, in this case, you're going in and you're writing those steps down. So maybe for that person who wants to get the driver's license, the first step is you go to the license bureau and you pick up the book to study. Maybe you help them review it. Maybe when you're driving around town with them, you're just kind of pointing out different things that you think are pertinent, like rules of the road. And then you take them to take the test. The cool thing about the action plan is that's really turned over to the provider. You guys, you're helping support this person doing this. We trust you. You know what you're doing. You've always done these things. If you find something that you're doing with the action plan that you've done a learning log and you go, oh, you know what, this really isn't working. I need to make some changes. Well, you can go in and you can change that action plan and how you're going about supporting that person in the outcome. You can change that action plan without it having to be an addendum to the plan. So maybe you've taken them and you're studying that book and you realize there's certain areas that they're really kind of struggling with. So maybe you revise that action plan a little bit to focus on these areas.
Lisa's going to show you, but you'll notice there's kind of two main sections of the action plan form. The top has a lot of boxes and things in it. The service coordinator completes that part. So the part that you're going to be coming up with is just the bottom where you actually put in the action steps. And the action steps, like what Kristen was talking about, going to the BMB and getting the booklet, helping the person study, those different things are the action steps, and that's the part that the provider will come up with the help of the service coordinator if you'd like.
And also realize when it comes to writing the action plan or the documentation, we're really fortunate in Lincoln County that we have a large number of people that have gone through training as coaches. So if you feel like, not all the service coordinators have been trained as coaches. They've all received training, but they haven't all received training as coaches. So if you feel like, hey, I feel like maybe we could use a little extra assistance, or maybe the service coordinator might say, you know what, I'm not that comfortable with action plans yet myself, so I'd like to invite a coach to sit down with us and go through this process.
I think that's the way it is with everybody right now. No one's really comfortable with what's going on because it's still not really up and running.
Right. It's been a big learning process. I look at where we are now compared to a year ago, and we've come a long, long way, but we're not there yet.
Once we get the concept, I know that everything is going to work fine. Once we get it here, that's my thing. Is even with the meeting that I had, I think I know, but to put it on paper, I still don't
And knowing to get down what the state wants.
Right.
Well, and it's really, Well, you mentioned the state, so I want to mention this. It even comes from a higher level. This is coming, yes, the Imagine plan itself is a pilot. It is a pilot in Ohio with DODD, who's working on supporting the IS system to creating the IS system to support it. But this pilot is driven by, at a federal level, Center for Medicaid Services. They're saying we want to pay for outcomes. The same language is even there. That yes, the care people receive is very important, and part of that payment, of course, is around their care. They want to see people achieving outcomes, things they want out of life. So this whole system is really to support that. So I know providers get a little uneasy about, are we doing what we need to do for all the powers that be? Yes. This system is to support what the powers that be want. Because the reason for that is it's supporting the people in the way they want to be supported. It goes beyond that point of caring for people to helping them achieve their life, helping them to achieve the things they want in life.
These outcomes should be something pertaining to to help these individuals along the way. Just be something they can be able to instead of like, say, I got 4 months, so that's what the plan is. Sooner or later, there's something will happen.
Right.
For them to live up. So your outcomes should be teaching them independence, not corporal outcomes.
I think, historically, the way we kind of looked at things is that we are the professionals, and so we're going to determine what a person needs. The point of person-centeredness and Imagine is to kind of move away from that and say that, that's great that we provide all of those things that people need and what we think they need, but we're kind of looking at, what kind of a life is it for that person if all they experience is what we think they need. The point is to figure out what they really want out of their life and what's important to them, because it's not always just about what's important for them. It's also very important to look at what they want out of their life and what makes their heart sing. And so that's kind of the point of these outcomes. It's not necessarily driven by, creating independence and all those things.
All 4 of these individuals, the service coordinator tells them that you like this, to do this. They'll agree. They don't care what it is, they'll agree. They can be going swimming Lake Erie for the middle of winter, they'll agree to it. That should be fine. We should do that.
We want people to be telling us. Yeah, we want people to be telling us what they want, not what we think they agree with.
Right.
Yeah.
Right.
And if you see that and some people are just very agreeable to whatever they hear. And the people very well, help support them and say, well, you mentioned such and such to me. You mentioned you thought this would be a cool thing to do. So, your input is very valuable.
The discovery should be happening with the providers, and so you have the opportunity to give that input, especially if the person doesn't use words to communicate, or maybe they just have a hard time really expressing what it is they like. That's where you guys come in and have that responsibility to kind of speak for them and making sure that that plan is something that is valuable to them and not something that a service coordinator thought had value.
They like to have activities also.
So are these, excuse me, are these sheets something that needs to be filled out daily?
No. The learning logs?
These are something that's like quarterly or?
Just as it happens.
The question is, should the learning logs be filled out daily?
And no, they're not like the old style documentation where you have to check something off every day. There is a minimal frequency. On the bottom of the outcome page, it will say action plan review, outcome review. It will say like weekly, bi-weekly, monthly, quarterly. So whatever is noted there, that tells you what your minimal frequency is. Now, if you learn things about that are pertinent, you can always, hey, you can write a learning log whenever you've learned something that you think is valuable to that outcome. But that Imagine Plan, those boxes give you kind of that minimal frequency. And realize when this is in the IS system, when you enter in an outcome, when you enter in a learning log, that alert will go out. The service coordinator will be able to see it. Like right now, while we're still in the paper process, we have to ask providers to, share the learning logs with us. But eventually, when it's in that system, we'll be able to see it. And you'll see, say there's a couple of providers working on the same outcome in different ways. They have like different roles. You'll see those. You'll see what's happened to help support that outcome.
Is this going to eventually, so this is going to eventually be online where we can just.
The question is, will this eventually be online?
Yes, you will access it through the DODD website. I will actually ask Elisa to speak to more details because she's been involved in the development of the IS system to talk a little more about what the provider portal will look like. But it's being designed to be very, very user friendly.
This is about we were just talking about that. Basically what it's going to be is it's going to be very nice. You can actually go online. You'll get a security code, and we'll be going into the system. It's through the DODD, and basically you'll go in, and you will be able to see everything that you've probably been doing by paper. And you'll be able to go in and have alerts set, so if the service coordinator puts something in there, you'll get a little ding or a little alert, and you can go in and look at that and add something, maybe agree or add a comment, and send it on its way. And the service coordinator on the other side will get an alert. So it'd be a nice way for you guys to communicate a little bit more seamlessly, and I think it'll be a lot more efficient time-wise for you too. And that is hopefully coming, they say maybe June, but we're thinking probably in the fall, just because things get behind a little bit. But do you have questions about that at all? Does that excite you to be able to kind of go one place and see everything? Yeah. Your forms will be there and different things.
Yeah, so then, what I guess what I was asking was, would we be able to do our paperwork?
The question is, will we be able to do our paperwork online?
Yes. Like your learning logs will be in there for you, and you can go in and make changes, save them, and send them, and then the service coordinator will say, oh, okay, she wanted to do some changes, let me check that out. So it'll be really nice that way.
You'll do your action plan on there. And if you, like I said, if you think, oh, I need to do some revisions to the action plan, you'll be able to go right in and do the revisions, and then the service coordinator and the person supported will see what's those changes.
Yeah, no. And we're just showing the action plan, and it seems like a lot of folks haven't seen that yet. So I think they were really scared of it, but once you see it, it seems like something that's very manageable. So you've seen the action plan? Okay. Thank you. Sure.
And
you guys seen it?
That IS system right now is being piloted in Fairfield County. So thank you to Fairfield County. They're kind of helping work through the bugs, and so by the time it rolls to Licking County, which we will coming to us next, then they will have already kind of worked through some of these things.
Yeah. You mean the whole thing was thrown out?
Well, it's like,
Oh, your service coordinator should have this, and you could just ask for it. What they've said is they've seen it, but it was a sample form. So maybe the service coordinator could just send you, they usually fill out the top part, like they'll put the name of the person supported, the outcome number, what the name of the outcome is, that should be from the plan. We just use vacation here. And then the module that they discovered that in. And then you've seen some of the other steps and everything here. Okay. Have you seen this too? Okay. But this is your meat and potatoes. Sure. Sure.
Any other questions or thoughts?
I'm just anxious to get started with it because I haven't even started with it yet. So,
And so is there somebody that you work with that you said you met recently, so that plan's being,
yeah, so, yeah, they were trying to help me figure it out. And I know that once I get started with it, it's gonna be easy. I know, it's just all something new.
right,
And the service coordinators are trying to figure it out as well, so.
Right. Right, so
Right.
we're all learning.
Exactly,
So,
exactly.
it's like I said, it's been a learning process. We've looked back now at some of the initial plans that were done last year and we go, oh, yeah, we have come a long way. Like I said, we know the mistake we made in those discovery results not coming out with the earliest plans. It's happening now, and like I said, if you get a plan without those, let the service coordinator know that you need those. That's where there's even more the kind of the detailed information.
If I get a question, it's usually from an independent provider just saying, I'm not sure if I'm keeping all the right documentation or if there's something else. I want to make sure I keep everything I need, so that I can be paid and that I do everything correctly. So it's more around that apprehension. Now, whenever I get those, should I ask them to just contact their service coordinator?
They can contact a service coordinator, or they can contact one of the coaches.
Okay.
And like I said, Sylvia Murray and Mike Piero and Bev Young are all actually being trained as, we're all coaches, but they're actually being trained as trainers.
So with questions like that, should I send them to the coaches?
Yes.
And then once the training's in place, sometime late summer, early fall, we'll do a training again for the providers and go through the documentation.
I have a compliance review in July. They haven't given me a date yet, but they give me July. And I was just a little worried about that, as far as my paperwork.
The questions around a compliance review this summer.
Right, and with the compliance reviews, they, part of what they're going to want to be looking at is, does the person know their outcome? Were they a part of developing this outcome? Do they know what it is? Is that still what they want? What's the progress towards that? So, whereas they're still going to be looking at, have you gotten your CPR training, all of those more personnel type stuff, they'll still be doing that. But they are, aware of what's going on within their Imagine, and they are going to be, saying, okay, so you have an Imagine plan, this is the outcome, and they'll be asking about that.
I had one of the first ones done in September last year, and the lady from New York had no clue what she needed on my paperwork. Yeah, it was a big problem.
That helped.
Well, she said I was the very first one she done, and she says, I don't even know what they want on it.
Okay.
Thing about it.
Yeah, it was new then.
Still new.
Still new.
Still new and not really
Right now, if somebody
working.
come in with my paperwork, the way I got set up, the box said, idiot, you know what you're doing, it's not done.
Even though it's new and it's still has, a lot of training around it, don't you think it will end up being better?
Yes.
No.
Oh,
When
stop it.
everybody gets it down.
My opinion,
Uh-huh.
no, I don't. I think their system, skill developments and everything else we were doing. This new system is taking a lot of things away.
The comment is the new system's taking a lot of things away. So maybe the way things were recorded.
And, what I understand.
And
So-
I think with that recording part, it's, what I wanna say is you, like, with the Imagine plan, and we'll be looking at learning logs and looking at whether people are, how they're doing with reaching their outcomes. You as a provider, if you are uncomfortable not having all of the very detailed sheets that you used to have, then keep them. It's okay. There's nothing wrong. The service coordinators aren't going to be going in to see if so-and-so had their shower or brushed their teeth or whatever. Obviously, if somebody's having issues there, then okay, then talk
Well,
about them. But
I use a checklist for all that stuff.
and you can still do that if that makes you feel better.
I have an individual, I have to shower, shaving, dressing. And I got a checklist. That's all, just a checklist.
One thing I just would encourage you to do is if you find yourself checking 3 different places, maybe the first step is just to try to kind of get rid of some of the duplication and only check it in one place. You know what I mean? If you want to have down that you did fire drills, but you did that on a service, in the old style, you did it on a service doc sheet, plus you had a fire drill form that you completed every time, get rid of that. But again, we want people to be comfortable. And we know that, you want to be comfortable when they come to look at your stuff, that you can have documentation to support what you've done. But that's just, you have a lot of leeway in that area about how you want to do that. And in terms of you mentioning skill development, where we're not going to see the old skill development things like so-and-so will be socially appropriate 8 out of 10 times for 70% of sessions or whatever. We're not going to see that, but that doesn't mean that we wouldn't still be helping the person to get along with others. And we're just not going to see it written in that old skill development style. But that doesn't mean we're not going to still support that person in those areas if they need support and some guidance.
Do you feel a little better?
I feel a little better.
Okay, good.
But each class, I want to go to each class, and I'll feel this much better every time. So I feel this much better than I did from my meeting this past
That's
week.
good. That's
So
progress.
that is progress.
Yeah.
Well, and in saying that, I want to mention too, and I have to say, I don't know the date of the next one. The county, the buddy county meetings, we're a buddy county with Fairfield County and with BHN. Providers are welcome to come to those. Those are some times where we as service coordination have been getting together to help support each other and to learn from each other. And now those are being opened up to providers to come and help do the same. And there's learning on the buddy county meetings.
I have down May 7th from 10 to noon, but I don't think it'll be in Lincoln County is the conversation.
Will you email it to me and then I can send it out to the
Sure.
providers?
I don't know that it's been decided
Okay,
yet.
but whenever you know, and then I
Yes.
can just.
Might be Fairfield, Cambridge. I don't know how much you guys want to drive, but we'll let you know.
And sometimes it'll be in Lincoln County, but it'll be more, turn taking or that. So not one county ends up driving.
But that would be good, just to even, because if you were feeling overwhelmed, it would be worth the drive to Lancaster or wherever to hear it. But then we could let them know whenever it's in Licking,
Sure.
for that. Agreed. Any more questions? Well, this really helped me. I took notes, and it just every piece of information helps a lot, and it will help me in answering questions, and I really appreciate it.
Thank you.
Thank you very much. Do you mind showing to the camera what you were showing?
Oh
people?
my.
Okay.
Oh, sure.
Because I won't be able to find it at 6 o'clock tonight.
And I just want to say too, if you guys are working with the service coordinators and you are still feeling lost and you don't feel like you're getting the information that you need, you can ask to speak with a coach. And there are people out there that we want to help you. We want to make sure everybody understands what's going on. So if you're just feeling lost and the service coordinator's not really understanding what get in contact with their team leader, they can help you out with that.
And if you don't feel comfortable saying that to the service coordinator, you can email me or just say, I had a meeting. And the service coordinator wants you to be able to understand
Right.
this, but they may
And
not
they-
understand what you're not understanding. So, and the coach has been trained to kind of be that gap. So for you to say, I really need to talk to someone more in depth.
And the service coordinators are trying to learn just as much
Yeah.
as we are.
Right,
Exactly.
everybody's learning.
But, yeah.
But that's a good point, thank you. Yeah.
Just a new way of doing business.
I know.
And we all love change.
Yay.
But, I just want to, I'd like to end with, if anybody has anything that they've experienced as successes so far, or any, if you, and I know you guys all have kind of different stages, but, we are seeing, it's really exciting, we are starting to see people meeting some outcomes, having some things happen that they want, and having progress. One example I can share recently, and I don't think in our old style, this person would have shared this information with her service coordinator, but based on kind of the way the discovery questions and kind of the way it's more conversational, somebody who doesn't have supports from a provider just said, my house is getting out of control. I've got a lot. I really need help. It's starting to overwhelm me. And, there's that little section about how our community resources, natural support's used. Well, at the time that was written, this natural support wasn't known of, but a service coordinator happened to share the information with everybody that this church was offering assistance to people who needed house cleanup, and so that woman, ended up benefiting from this community resource. She shared the information what she needed with the service coordinator. Service coordinator got her hooked up with this community resource, and she's thrilled. So it's really exciting when we see these things starting to happen.
You guys had any experiences yet? Still at the beginning.
I will.
We will call on you, Nancy, for that positive experience.
Do you guys have any?
Little steps, but not big ones.
It's great.
Well, thank you. If you'll show that to the screen, that would be great. To the camera.
Hi, camera. This is the action plan. Hopefully providers have seen this. It has the person supported. Oh, thank you. The outcome number, the outcome name, where this was discovered from the different modules. Oops, not working. Support considerations that could be related to budget. Maybe they'd like to vacation somewhere dry, somewhere where the water. Assigned provider, the frequency of reporting, and then right here, oops. The action steps. How will we accomplish the outcome? And then the person that's responsible for completing the action steps. If you haven't seen this, you may want to check with your service coordinator. They'd be happy to give that to you. Thanks.